I want to talk, as you said, less of why we are here, but more on how to deal with it now. Because I think we all agree, and I think already these few statements have been very clear. The science is obvious and clear to us. Elimination and vaccinations are the cornerstones. If there are not sufficient vaccines available, or if the vaccine by itself are not sufficient to control the pandemic, you apply or supplement with a combination of tools, the classical tools like contact reduction and isolation, as well as modern tools like tests and tracing systems, ventilation, high quality masks, and so on. We have heard it all. I just want to briefly summarize to get to the point. But if the science is so clear, and we have heard it already today in a variety of talks, and many will follow today and tomorrow, that all come to the same conclusions that the elimination strategy is the best for everybody. If the science is so clear, how come that countries take such different approaches, especially when you compare the Asian Pacific countries with the European countries and the US? I mean, if you all know, if a physician in Australia plans a medical procedure, we expect he or she follows the same literature, protocols as his colleagues in the United States. And similar, an engineer in New Zealand encounters a technological challenge, she follows the same scientific principles as the colleagues in Europe. I leave the analysis of state stability as a possible cause for this paradox between pandemic conditions and regular conditions to the psychologists and the political scientists. But I assume at least one thing is a clear difference between a medical procedure, an engineer, and a pandemic. It is that this is not just a problem, but we have a full-blown crisis at hand, which shakes the pillars of a society and creates a degree of disorientation that we are facing. I think the past 18 months have shown this, at least in Germany, very clearly. Either way, I just like Noam Chomsky said, there's only one known successful strategy to respond to an urgent crisis when leadership fails. And in many of our countries, and that has brought us together, this is the case. You need an informed and or a scientific guided community that demonstrates engagement. This may eventually compel the decision makers, or hopefully compel the decision makers to act. So I'm happy to say that this, of course, is exactly one of the key motivations of the World Health Networks, offering ideas and opportunities for science guiding community action. And Jörg Danzer from End Corona in Germany, which played a very important role for me during the entire pandemic, will actually elaborate on such community actions in his next presentations. But let me close with one example on the important and very much underestimated role of academic institutions in this process to deal with crisis. I believe the university campus is one of the best inventions of mankind. You already have the scientists there, which can answer the questions and give science-based guidance, but you have so much more. And particularly, you have a community that wants to be informed and is ready to engage. And quite importantly, the university has a high degree of independency, for the simple fact that independency is at the very core of all science. The president of the Technical University in Dortmund, for instance, a physicist, accepted the science and acted accordingly when large parts of the political institutions, as well as parts of the society, were in a state of disorientation or even confusion. The positive model at the university not only worked and led to a green zone on our campus, with no community transmission since about 8 months now, it also inspired the city. One symptom of inspiration is the fact that just now, where large parts of Germany are in a frenzy to drop all restrictions despite very high infection rates and death, the city of Dortmund decided the opposite and expanded their testing strategies in daycare centers massively. And the university, they implemented a research study offering fast PCR tests 4 times a week. It not only encourages all students and members of the university, including those vaccinated, to go get tested, but it invites also their family members or partners to take part in the study for free. So let me come to an end and summarize my main point. The community action is the key for changes during a crisis, and the university has an incredible potential to be the jump starter for the process. The knowledge, the science, and the thousands of young students willing to engage and work for a better world are already connected. The network which is already there. and it represents a great source of resilience in such times. If they are mobilized and go out there to inform the general public, leading to more mobilization and more active groups in a self-propelling process, decision makers will eventually feel compelled to act. This applies, of course, to any crisis, I believe, including the one about the climate. Thanks for not giving up.